Deeply Human was founded in 2020 by a group of engineers wanting to amplify human intelligence through artificial intelligence. There's no limit to how people explore the world around them, and we want to empower our users to capture every moment to better learn about their uniqueness and connectedness. We at Deeply Human believe that AI has the potential to impact virtually every industry and every human being. Our vision is to create a platform that makes AI less artificial and more intelligent. Thus, we are developing what we call the Neuron storage architecture, modeled after the intricacies and interconnectivities of the human brain. Our design melds deep learning and machine learning neural networks with high-performance flash storage, effectively bridging the gap between data collection, data analysis, and data storage. We look forward to how this robust design will power data-trained models and improve AI capabilities to help our users learn and create like never before. Deeply Human presents Neuron Storage, a hybrid flash AI storage hardware solution optimized to accelerate machine learning capabilities and improve how clinicians diagnose and treat patients. Built with 1.6 petabytes of flash storage and directly communicating with Cipher, Inference, SLAM, and LiDAR engines, this hardware solution leverages proven AI technologies such as ResNet, TensorFlow, PyTorch, Caffe, and YOLO to provide the ultimate AI hardware platform to power complex and ever-learning medical programs. At heart of the Neuron storage architecture is our proprietary SoC, which sits along with 21 terabytes of M2 form factor flash within our Neuron storage carrier. Up to 72 carriers can be housed within our 3U Neuron storage chassis, creating a 1.6 petabyte multiple I/O interface storage system. Within our ASIC sits multiple ARM processors, dedicated AES Cipher engines, RAID controllers, SLAM, and LiDAR engines. These specialized inference processors and algorithms allow a wide range of ported programs to assist with diagnostic processes, treatment protocols, drug development, personalized medicine, telemedicine, and patient monitoring and care. For mobile applications, carriers can be used individually to intelligently control edge devices such as CT and MRI machines or tablets. Additionally, video, image, and audio inference engines allow direct communication with peripherals such as cameras and microphones. Simply put, inference engines can quickly analyze voice input of symptoms, sounds traditionally heard by stethoscopes or ultrasound, and radiological images such as biopsy samples, X-rays, CT or MRI scans, etc., which can greatly aid our medical professionals. With internal drives utilizing PCIe, in addition to RAM and MRA memories, we have built a powerful AI accelerator with enough performance for any AI implementation. Now more than ever, high-tech businesses and researchers harnessing the power of AI are taking advantage of PCI Express, which supports the non-volatile memory Express protocol, allowing the low latency and high throughput required by computationally intensive AI training. This technology puts in the hands of medical professionals rapid predictive capability to help clinicians make the best diagnosis and treatment plans. Our first-of-its-kind architecture physically places the AI processing engines adjacent to the flash storage medium, effectively shortening the distance data must travel. Never before has AI processing and data access had direct communication within a single chip or storage system. Our patented system-on-chip architecture brings together storage and computation, creating a miniaturized all-in-one package designed to be both cost-effective and robust. Interwoven redundancy means the system is protected against numerous nodal failures, as alternative accessible routes ensure all critical data is captured. Additionally, multiple layers of RAID allows reconstruction of uncorrectable blocks and even entire flash AI carriers. Autonomous auto-correction and disaster recovery limit the need to swap out malfunctioning parts or worse, replace the storage system. Our resilient, always up and running, hot swappable architecture reduces maintenance costs and downtime. No longer will data centers be susceptible to a single point of failure, causing an unrecoverable total system crash. A well-built all-flash array can easily remain functional for 7 to 10 years with little maintenance. An exciting use of our Neuron storage technology is the rapid interpretation of radiological imaging aimed at assisting our military clinicians who, through human error, may make an incorrect diagnosis otherwise. A team of Stanford researchers using an AI algorithm detected pneumonia at a greater rate when pitted against a group of highly trained radiologists. Another study done in 2018 by researchers at Seoul National University Hospital and College of Medicine developed an AI algorithm called DLAD, Deep Learning-Based Automatic Detection, which analyzed chest radiographs to detect potential cancers. The 2019 Lancet Digital Health study showed that out of 14 studies, deep learning models and healthcare professionals with the same sample performed equally well at diagnosis, with medical imaging being the sole criteria. The algorithm effectively outperformed 17 of 18 doctors who analyzed the same radiographs. These studies demonstrate how our neuron storage platform can be trained to analyze diagnostic radiographic imagery to formulate more meaningful medical diagnoses. AI has a bright future in the accurate diagnosis of disease beyond those traditionally requiring radiographic scans. There is great interest in how AI can help reduce mortality and morbidity of chronic diseases such as diabetes and cardiovascular disease, two of the top 10 causes of death worldwide. Additionally, constantly mutating bacteria and viruses means ever-evolving diagnostic criteria and treatment plans for novel infectious disease. The journal Annals of Oncology published a paper in 2018 showing that AI systems centered around a deep learning convolution neural network accurately detected skin cancer 95% of the time, compared to 86% when compared to dermatologists. In 2018, researchers at Google AI Healthcare created the algorithm LINA, Lymph Node Assistant, that accurately classified a sample of cancerous or non-cancerous tissue samples 99% of the time. When used in conjunction with clinical analysis, average time for review was halved. With upcoming advances in AI, deep learning is poised to become more efficient and an essential diagnostic tool for all primary care physicians. Results like these show extraordinary promise in how our NS technology can power a wide range of medical AI algorithms to more accurately diagnose a spectrum of conditions commonly affecting our servicemen and women. Now more than ever, the public is aware of the importance of fast and accurate diagnosis in terms of slowing the spread of infectious disease. We at Neuron Storage understand that airmen and their families often live base to base or are stationed around the world, effectively limiting access to their primary care physicians. Frequent travel means our airmen often require a change in primary care physician, which lessens quality of care and puts them at risk. For this reason, we foresee a natural migration to telemedicine within the armed forces. With the rapid rise in access to telehealth platforms, especially during the recent coronavirus pandemic, the quantum of health-related digital data has seen an exponential increase. The raw amount of computerized patient data has grown so large that it has become unmanageable and inaccessible to clinicians who need instantly accessible and easy to understand information. Thus, more sophisticated data-enriched environments utilizing automation means better clinical decision-making and health outcomes. It's easy to see why AI has a clear role in teleassessment, telediagnosis, teleinteractions, and telemonitoring. Through analysis of symptoms and patient records, Our platform in real time can directly power chatbots to recommend a diagnosis to a physician or help a patient better understand their condition. Our NSAI system aims to advance remote health care service to create a doctor-patient technology relationship. Computational power coupled with optimized AI algorithms are revolutionizing the drug development process. The pharmaceutical industry faces a unique challenge in sustaining the drug development programs, despite the long timelines required for R&D and heavy financial costs associated. AI is helping discover relationships between diseases, biological targets, and drugs. Our NS technology can help create curated databases for analysis and organization of thousands of genomic, phenotypic, and clinical data sets, effectively allowing researchers to identify new targets and biomarkers, repurpose drugs, and target disease pathways. Never before has analysis and organization of biomedical research and publications been made easier. Additionally, our platform has the raw power necessary to rapidly develop antidotes to novel chemical and biological weapons being developed by our enemies around the world. We are developing an absolutely essential tool for our military intelligence professionals who, without compromise, require the most advanced technology to respond to potential threats of biological and chemical warfare. Our NS platform was designed to provide the raw computational power to execute medical AI algorithms blazingly fast, to be useful in the hospital setting, even during emergency or trauma situations. No longer do primary care physicians need to wait hours or days for a radiologist or specialist to review a radiological scan. Our technology can provide rapid analysis of these scans and provide an accurate diagnosis, often better than clinicians, so that primary care physicians can respond to patient concerns fast and effectively. With the need for maximum security and confidentiality, many hospitals chose to deploy on-premises data centers rather than rely on cloud storage. Having an on-premises storage solution gives IT administrators ultimate control over physical data centers, adding a level of protection against hackers looking to silently capture patient data or install malware or viruses meant to shut down vital systems. You care to learn more? Please visit our website or email us. We would love to hear from you. Thank you for visiting our booth. Goodbye.